glad to be here in another capacity as Minister, the Acting Dean, Professor Roger Ganeshwar, our speakers and friends from abroad. Thank you for giving your time to be here in Fiji. Members of the students and staff, members of the press, those of you who are part of this important branch of medicine, pathology, and those who are here just to listen and learn, and invited guests, ladies and gentlemen. I think at the outset I must say I loved that keynote address. It gave me a greater awareness of what pathology is all about and about the history of it. This morning I can tell you, as I was in the car coming from home, I live in Nakasi, so I was on YouTube learning what is pathology about. Thank God for the internet. Thank God for the TED Talks. Thank God for Dr. Google, who's always teaching me the things that need to be done. But I'm glad to be here. This is a great occasion, a commendable occasion. As a former trainer and a person who's believed in training and the sharing of knowledge, I think it's one of the most important things that we can do to enhance the service that we give to people, is to have sessions where we impart knowledge, where we share experiences. I've always said this in a number of forums that I've been to. We have limited resources in life, but there is one resource that we have. The more that you use it, the more it grows, and that is knowledge. The more that you use it, the more it grows. So it's important to have sessions like this. I have been informed that this event is the principal event in the calendar for Pacific pathologists. I hope there are others from other countries here. Are there people from other countries here, or is it just from Fiji? Some from some other countries, eh? Good, that's good to see. And I've learned that pathology services, what I learned from the internet this morning was that it's about the study of suffering. I think with the intent of not continuing the suffering, but to cease the suffering. And that's something that speaks volumes to me, because in our ministry, the Ministry of Health, our vision is very simple. Our vision is basically to have a population that is healthier. And in order to have that healthier population, we obviously need to understand why it is that people are suffering. So through the deliberations and through the discussions you have today, hopefully there will be more knowledge coming out, the distribution of this knowledge, the deployment of this knowledge, so that it can affect the ability of people in the medical fraternity to try to ease the suffering and try to build this country towards a healthier population into the future. This symposium is a collaboration between the Fijian National University and the International Academy of Pathology, and it is enabling international and local pathologists and clinicians to get together to support academia and professional development of services in the region. The strong and commendable contributions from pathologists in professional institutions throughout the world, namely the Australasian branch of the International Academy of Pathologists and from Fiji, are to be noted. We have speakers, as has been mentioned, from Thailand, Japan, and Australia, and those who are already in Fiji who have been from Sri Lanka and from other countries. The dedication to the advancement of pathology education and professional mentoring of pathologists in the Pacific is what brings us here today. Looking through the program and looking through the list of speakers, I've noticed the breadth of the health topics covered, and note the continuing menace that non-communicable diseases, including the various forms of cancers, which I believe is the focus of this particular conference, this particular symposium, that pose to our Pacific populations. Just a few weeks ago, I was chairing the meeting of the Pacific Health Ministers. We had this down at Yanuda Island, at the Fijian resort. And one of the things that was illustrated, that was stressed again and again, was the importance of NCDs and how it is having such a debilitating effect on all of our countries in the Pacific. How it's affecting economies, how it's affecting all the things that Professor Ganeshwar was saying. Welfare of people is how it's affecting the creation of wealth. And as we create wealth, we are then able to provide all the things that we need. Sanitation, water, social welfare, building of hospitals. NCDs is a scourge. It's a tsunami. Just like that we have climate change in the world, I think two of the greatest challenges that we have in the Pacific are NCDs and climate change. It's going to have long-term impact on us. And it's something that we need to do something about. Current Pacific health indicators that we discussed at the Pacific Health Ministers meeting were saying all of our indicators in the Pacific are going up like this. They're going up. But the problem with our indicators Our indicators are going up like this. In other countries, it's going like this. So that's our challenge that we have. We are crawling, others are beginning to sprint. So we need to find ways to deal with this. And that is something that we've been addressing over the past 2 days. Yesterday we had a meeting looking at the 5-year plan of the Ministry of Health, which covers all the activities that we do in Fiji. And we hope that we can come up with strategies to combat that, to deal with those kinds of issues. That's why a kind of program that you have today, where you share knowledge, where you grow knowledge, where you impart experiences, all of these things are very important to give us new learnings and new ways of looking at things so we can try to begin to combat the problems that we have in the areas of NCDs and in cancers also. As such, the Pacific Ministers for Health have reaffirmed their commitment to reinvigorating their fight against NCDs. Later on this month, the World Health Assembly will take place in Geneva, and I have been appointed to be the voice of the Pacific, to speak on the things that we have found in the Pacific, the messages that we in the Pacific need to take to the global forum so that they are aware of what's happening in the Pacific. The level of NCD problems in the Pacific is probably, you can treat the Pacific as almost like a laboratory where the kind of practices and new ways that we use here in the Pacific will then be used and replicated in other parts of the world. So we play an important role in terms of the growth of NCDs is almost beginning to become exponential here. So we need to look at the new measures that we can do to take this, to address this, and hopefully at the World Health Assembly we'll be able to share these concerns with the world. The globe needs to make sure that it is able to provide funding and other things that allow us to deal with these problems here, because that learning can be applied to other parts of the world in the future. Just as the Pacific Island nations are vulnerable to the effects of global warming, the economic effects of the NC burden is handicapping the economic growth of many of our nations, both in terms of loss of productivity and contribution by an active economic age band, but also to the cost to the health system. This is one of the reasons in the current annual corporate plan for the Ministry of Health, one of our key targets is to strengthen our screening across the country, to screen people. We have a target of 90,000 people that we want to screen, so we can identify those who are likely to have the problem areas and start working with them and working with other partners, our partners in our CSOs and NGOs, to try to manage the problems that they have. A lot of the problems that people have are obviously things that are not reversible, but they can be managed to make sure that people remain in the workforce. They can be as productive as possible to create wealth for this country, so that wealth can then be used to help the lives of everybody else in the country. As you deliberate over the next 2 days, it is hoped that advances in this field, your field that you're interested in, will translate into enhanced patient care and preventive outcomes. In the health system, quality is the goal that drives processes. Quality, delivering things. For our quality is all about delivering value. And value is always defined by those for whom we provide the services. Value is defined by patients. Value is defined by customers. Value is defined by the nation as a whole. Within the pathology fraternity, ensuring every citizen of Fiji has access to a quality-assured diagnostic service is a priority, ensuring standard and quality in the laboratory service. I think there's something wrong with that sentence. In rising to face the challenges of managing the increasing numbers of patients with various forms of cancer, the Ministry of Health and Medical Services is forging forward with efforts to strengthen oncology services. This is one of the areas that we hope to work. We hope to put some attention on. We need to define the degree to which we provide services in oncology. But it is one of my focus areas. Although in the long term, as Professor Rajat has been pointing out to me, that in the long term, one of the strategic things that we will have to answer in this country, what is the mix between curative and preventive? Ultimately, if there's more emphasis on preventive, it will allow us to deal with things so we don't have a lot of people coming to our hospitals where they need curative services. Where am I? In doing so, patients being diagnosed with cancer will have a wider range of treatment options and have a chance of better outlook. Central to this care is a multidisciplinary team approach, and the service of pathologists will be key. I am very grateful to be here at this, and I must congratulate those who have organized this. Your list of speakers is very impressive. There'll be a lot of knowledge that is here. I hope that you use this opportunity. It's really a great opportunity to listen to people, listen to their experiences, to reflect on what they talk about. But they say that training or education is never complete until it translates into behavior. You take knowledge, it's useless unless it impacts on behavior. So I hope that as a result of this education that you have here today, as a result of all the knowledge that will lead to something inside you as you reflect on it, and together we'll be able to change behaviors, to change something, to have an impact on the health of this country. I wish you well for your conference, your symposium, and God bless you all.